And hi, everyone. TJ Alt, I-45 now, Galveston now, and bringing you our weekly edition of What You Need to Know with Dr. Philip Keiser, CEO of the Galveston County Health District and our local health authority in Galveston County. Dr. Keiser, thanks for coming on with us, as always, this week. I wanted to get into, I was reading over some studies out of the UK on the subject with COVID-19. It relates to long-term effects, or what we call long COVID, with folks. One of the things that their initial studies are showing is that those folks who have been vaccinated or fully vaccinated are having less long-term effects on that. Now, obviously, the vaccination is to protect it is to protect you from getting super really sick from COVID-19. But have you seen any similar type of studies going on in the U.S. on this, of what we can expect, that maybe vaccines are also helping on the long-term effects?
Yeah, no, I saw that study as well, and it makes a lot of sense that vaccine helps prevent the long-term effects. When you think about where do these long-term effects come from, well, you get some from the direct damage from the virus. So if you're not vaccinated, you're going to have more damage to your lungs. We know the virus also gets inside the brain. So if you're not vaccinated, you're going to have higher levels of virus and it'll get inside your brain. And that may be responsible for the problems with thinking and concentrating and focus that we're seeing. And some of the other things are probably due to an immunologic response, meaning that in order to fight off the virus, your immune system reacts very broadly. And the more virus you have, the broader that immune response will be, which then continues on and then makes people feel bad for a very long time. So none of that's surprising at all.
One of the things, obviously, when we talk about those long-term effects, one of the things too that I've been talking about for those on the memory loss, and I'm one of those folks that every once in a while I've been dealing with that that we think is COVID related. But I know my buddy Chauncey Glover at Channel 13, KTRK, is actually doing brain mapping right now to see that. And we haven't talked much about those issues that are taking place. And I'm showing you right now, this is the story on ABC 13. That's Chauncey Glover. He's an anchor at Channel 13. And he'd gotten COVID, and he's been doing, and he did brain mapping. And he says his IQ jumped 21 points after going brain mapping. Have you looked at any of these things here right now? Because brain mapping holds a lot of promises in a lot of areas right now.
Right. And again, that so the question is why do we see these things happening? And so presumably one of the mechanisms, not the sole mechanism, but one of the mechanisms is that the virus disrupts our normal neuronal pathways. And so instead of the electricity going through one way, it has to try and find another way. And then something can happen and give a jolt to the system, which can bring it back. I have a friend of mine whose wife had a loss of smell and taste for almost a year, got a separate respiratory infection, and zap, it literally came back the next day. She woke up and she goes, I can smell. And so what does that mean? That doesn't happen because of the infection. It happens because that infection also did something to the way that the neurons are working. So, it makes sense that when you're going through and it's part of this process that you're seeing here, trying to understand where things are going, is that you're also getting little shots of electricity that are going through there, and that may actually help your body renormalize in terms of the way that the electricity is flowing and that the neurons are flowing, and can improve things. So it makes a lot of sense.
And one of the things we're going to try to do is spend a little bit more time looking at these long-term issues that are of effect from this. One of the things we pointed out is that what we're looking at right now, where we are with COVID-19, is that we're seeing the numbers drop. I mean, last week when you and I spoke, we were talking about close to more than 7,000 cases that were active. It's now less than 6,000, actually about 5,700. That are happening right now in the county. You're seeing these numbers drop. And you had said that one of the things was, as I bring up the screen now, is we'd see this kind of spike down, quick like a roller coaster down. And it's been on track from what, you said, it would be about this time we would see that drop. based on what we knew about Omicron and where it did in South Africa and the like.
Yeah. So we looked at South Africa, we looked at other countries, and the UK, for example. The UK in some ways mirrored what we were doing, but the UK was also having a Delta surge when they got Omicron. So they had high levels and then they jumped even higher. And South Africa had very low levels and they jumped up high and they went down very quickly. So if we take that same sort of formula for the way they go up and down and applied it to Galveston data, in January, we were expecting that come mid-February, in fact, this week, the week that Mardi Gras starts, that we would be getting close to the bottom. Now, we haven't seen bottom yet, and that's really good news. And every week that goes by, I just hold my breath thinking, okay, it's going to start leveling out, or it might start to jump up again. But so far that prediction is holding, and I'm just very, very happy about that.
You'd mentioned about Mardi Gras and in COVID-19. There was a time we would be talking about super spreader events.
Right.
Last year, Mardi Gras was actually canceled before. Obviously, the freeze would have taken care of that anyway, but it was canceled before that because of COVID-19. And it would have been held the year before, right before we started seeing the real big outbreaks from COVID-19. So why is that not a concern now of calling it such an event as a super spreader? Yeah. Is it because the vaccinations and the therapies are better or the like, or why is there just less concern now, or why?
It's a little bit of everything. So let's talk about vaccines and immunity. So the first thing is that a lot of people are vaccinated. About 70% of the people in the county have at least one shot in their arm. And so that provides significant immunity. Then we have over 80,000 people that have had an infection. And what we know very differently from what we knew last year was that infection actually protects you from getting reinfected. In fact, the people that are best are those people that have had an infection and a vaccine. And probably about 40,000 of those 80,000 have actually gone on and gotten the vaccine. So, you add up, let's say 230,000 people plus another 50,000, 60,000. We're getting close to 300,000 people in the county with some immunity, which means that we only have 50,000 people who are at risk for getting a severe infection. Before the Omicron outbreak or surge, that was over 110,000 people. So that number of people that are at risk has dropped quite a bit. So we have a lot of immunity out there. Granted, it's not perfect. It's not the best. It's not what we'd like to see everybody to have, but it's something. The second thing is that our therapeutics have gotten good. We have monoclonal antibodies. We had to shepherd them through the Omicron surge to make sure we had enough for the sickest people. But now the FDA has approved another monoclonal antibody, which also works against Omicron, and we'll be getting that soon. So we're going to have plenty of monoclonal antibodies for those people who are at highest risk for getting sick and getting in the hospital that we can give them if they have COVID. We also have pills. We also have Paxlovid. And that drug reduces the risk of getting hospitalized and death by over 90%. So we've got a lot of, and it's in the pharmacies. It's in, Walmart has it in the pharmacies. UTMB has a limited supply right now, and there's more coming as time goes on. So we're really getting to a point where I think we can treat most people. And as a consequence, we're seeing our hospitalization rates go down as the peaks go down as well. So I think overall, if you get COVID, if you've been vaccinated or if you've had it before, the chance of you getting really sick is much less. If you do get sick, we have therapeutics that we can give you. And just kind of keeping the eye on the ball. What was the whole reason behind doing shutdowns and stopping events? It wasn't, to stop people's lives, and it wasn't to take over the government or any of these things. It was to protect the hospital systems, and right now our hospital systems are in good shape, and so I think everybody's feeling a lot easier and a lot better about it as we go into the Mardi Gras, and people want to celebrate. In many ways we have good reason to celebrate.
And speaking of the hospitalizations rate, we've got the chart up there right now on the total number of hospitalizations broken down by race, gender, age, as well, and so that's bringing, as you said, bringing the numbers considerably down and over a period of time. I thought it was interesting you had mentioned about the COVID pills before you and I came on. is how available are those now? Because early on we were seeing like, okay, the supply really wasn't there, but you checked it and the actual supply is there right now locally. You just got to know where to look for it.
Right. And so my best advice would be to, go to a Walmart website. So here's what's supposed to happen. Okay. Is that when you go see your doctor and you have COVID and the doctor decides that you would benefit from the pill, he or she is supposed to check online to see where it's available and make sure the script gets to that place. And so, for example, UTMB has some. It's in our outpatient pharmacies. We don't have a lot, but we have some. Walmart has got it in all of their pharmacies. And so you can check to see whether there's some available and then take that prescription there and then get it filled. And we expect more to come. So the supply chain's getting better and we're getting more and more. And we expect it to be in almost all the pharmacies within a month or so.
Now, that does have to be prescribed, but your surprise is not as prevalent in prescriptions right now.
I would have expected more people to use it, but I think there have been two concerns. One is that people think it's not available, right? So they're not going to their doctor. They don't want to go get an infusion. So that's issue number one. The other issue is that, we want doctors in the community to know it is available and you should be using it. And so I think a lot of doctors are thinking, there's no point. I can't get it. Well, that's not true. It's out there. We should be using it. And then I ran into something very interesting when we got some at UTMB. We didn't get very much. And so some people are saying, oh, we got to be careful or we'll run out. And I'm going, of course we're going to run out. Let's run out. Let's give it to people. And they'll give us more. And, one of the things I think we've learned with the programs where the federal government is allocating this stuff, if you don't use it, they're not going to give you any more. So
that was one of the things is like when you had the mass vaccinations at Walter Hall Park, it was like, if there was any left, I remember we'd always get the call, hey, we have, several, shots left. Get the word out. Just show up. And
y'all come. Right.
Anybody who was in the park if you were within shouting distance of the park, you were able to get a vaccination and not wait.
That's right.
Along the lines. Speaking of those COVID pills, here's a good Kristen Allen asked, can children take the COVID pills and what's the age limit? Right now, I think it's still recommended adults only, correct?
It's a weight limit. It's 40 pounds or more.
Okay. A weight limit. Okay, not age limit.
It's weight. 40 pounds. Weight dose, right. And so that depending on what size your kid is. Actually, I think it's 40 kilograms maybe, but let me check on that. But it's a weight. It's weight-based. It's not age-based per se.
Gotcha. All right. And then someone asked here too, Aaron Fletcher, are we going to be able to use antibody therapy for other infections, or is it just a COVID-19? Because you and I talked about mRNA-based stuff, based stuff, and all that. We're going to see an expansion, I think, of this technology. Will we see the same thing of the antibody therapies, you think?
Yeah, we may, depending on what it is and depending on whether there are other effective therapies. I think one of the real benefits of the monoclonal antibodies is that they can be made in large quantities very quickly, right? Look how quickly these things came out for us to use. And then even when there were problems, how quickly they've changed. Remember, it was just November. I mean, it seems like forever ago, but it was just November that Omicron came out, and now it's February, and there's one specific for Omicron. So these things, the monoclonal antibodies can be made very rapidly and altered very rapidly, which is a real strength of them. I think a lot of it depends on what the issue is. We've certainly used antibodies to treat things over the years, a lot, but never to the extent that we have with COVID. And so I think this may open another door, and we'll see as time goes on.
And going back to talking about the COVID pills, Regina Haley asked, what are the side effects of the pill treatment? So far, what I've seen has been kind of minor side effects of like feeling drowsy, or not drowsy, but feeling lethargic or something like that. That's
feeling
about
funny.
it I've read.
Yeah, so this has two pills in it. It has one that actually kills the virus and another one that increases the level of the medication that kills the virus. That's a drug called Retinovir, which we've used in HIV patients for many, many years. And so that drug has a wide variety of side effects. It can make people feel sleepy. It can give people kind of a little bit of out of body experience. it can cause nausea and it can cause diarrhea for real. And so just be careful with that. But the good news is that these are small doses of this drug, and you only take it for 5 days. And so most people aren't having major effects from it.
I mentioned that when we got in here, last week, that one of the things we're seeing is, folks who are missing out on their regular checkups and the like.
Right.
And one is a CDC study that shows that up to 80% in cancer screenings they've seen an 80% drop, I should say.
Yeah, totally believable.
This is mainly breast and cervical, but also colon cancer has been about the same numbers, but it's up in the 70% almost everywhere across the board. And you provided an anecdote to me before we came on the air, was that you're seeing the same thing as far as in the clinics for the health district, correct?
Sure, absolutely. And so in some ways it makes sense, right? That think about 2 years ago, pretty much all outpatient clinics were closed all across the country, right? And then we started going to telemedicine, and so people were only seen in the clinic if they had some sort of acute illness that required them to be seen, and you could see your doctor for your routine visit via telemedicine. Well, we can't do a cervical smear by telehealth, and we can't do breast cancer screening by telehealth, and so a lot of that really fell off. And we recently actually so as clinics are coming back and have come back to normal, we're still seeing a big lag in that. And for example, our breast cancer screening, colon cancer screening, and cervical cancer screenings really have fallen off a lot. So we're making that a priority for the next year. Those are our big three that we're really going to be concentrating on to try and make sure that we catch up and get to where we need to be with doing that screening.
And there've been other drops too that you're seeing that along the way. Just basic health issues. I know I talked to several cardiologists not too long ago who are all telling me, listen, I haven't seen a lot of my patients in 2 years, and they were on a high level of risk in areas, and they're concerned because they haven't seen him since. I wondered, will the health district also be kind of adopting a campaign to just promote folks to get general welfare checks and physicals and the like right now?
Well, we're doing that right now. So we're trying to get new patients in. So during the worst part of the COVID epidemic, our active caseload dropped to about 3,000 patients from about 14,000. In 6 months, we're back up to about 8,000 active patients. And we're already seeing huge demands for people to come in and get their regular doctor visits. And so if you were to call today, we probably wouldn't be able to accommodate you this week. You'd probably have to put you off. And so we've had some strategy meetings about, okay, how do we work in the people who need to get their acute problems taken care of right away? How do we, people that just want to establish care but are doing okay, how do we distinguish those so we can get them screened? And we're even having conversations now about bringing some people in temporary, bringing some locum tenens, as they're called, but basically temporary doctors and physicians' assistants to try and catch up on some of these things. This is a common problem. This isn't just us. This is all over the country that people are having this problem.
And it's all in dental, I should point out. I know your wife would want us to make sure we stress that for the dentist. But the dental side, that was an interesting thing too, is that a lot of folks are not going in for the dental checkups right now.
Yeah, people are scared. And so what has happened is that people fall off. They're not used to going. And now that they come back, they're still concerned because they were told, oh, this is where all the people with COVID go, and I can get COVID. We even had one guy come in with a mask for himself, a mask for the dental hygienist, and a mask for the dentist. We said, okay, we've got our own masks. But there is that fear out there that still exists, even though I think in terms of transmission of COVID within a healthcare system, we've really got that down. And, we know what to do to protect ourselves. We know what to do to protect our patients. And so people don't need to be afraid anymore.
One of the things too, we talk about, we're going to see a lot of mask mandates drop other parts of the country. Obviously around Texas, there are very few places that's a requirement, but a lot of other of those, we've seen the big protests happen in Canada because of vaccination mandates and the like. And I asked this question to you last week: are we just done with COVID? But from what I'm hearing you say here is that we're actually at a manageable pace now that we can live with, versus, hey, we need to do
I'm cautiously optimistic. I'm very hopeful, and I say this with great trepidation because you say stuff and people put in, but I'm hopeful we're done with the big surges. Now, there can always be a variant that we had never dreamed of that'll come out and do just like Omicron did. Remember, we didn't know about Omicron the first 2 weeks of November, and by Thanksgiving, it was starting to roll over our country, and something like that could happen again. But I'm hopeful that we're done with these big surges, and we will continue to have these low levels that we can continue to try and manage and also learn to adapt ourselves to. That being said, masks do prevent transmission of COVID. They keep people from getting it. They keep you from giving it to someone else, and so, even though we're not in a mask mandate state, recommend that if you're concerned at all, go ahead and wear a mask. It's okay. And a lot of people are, kind of nervous about that, but it's okay. And if you're a high-risk individual, if you go out, you definitely should be wearing a mask, and probably be wearing an N95 mask. So, Texas is a place that believes in individual responsibility. And so part of that means that you got to figure out where you are and do what it is that you need to do. So, please, if you're worried about it, please go ahead and wear that mask.
There's a raging debate going on with some folks in our chat room. They're not asking questions; they're just kind of arguing with themselves. But we have one of our normal deniers that is in here that's talking about that it's showing the vaccinations have not stopped COVID. That would be accurate. Not stopped it.
That's correct. That's right. They haven't stopped it. Right.
But for the most part, vaccines have worked.
Yeah, that's why we're having Mardi Gras.
That's why Mardi Gras is happening.
Right.
That's the part. This is just pure data that we look at, that we're looking at here. This is just, that's what I try to tell folks, that this data you're seeing here is because we should point out that of those in the hospital right now, of those that are dying, while deaths have never been the real focus of this, but it's still, most of them, the vast majority, are unvaccinated.
That's correct. And in fact, if you look at that active caseload, I would say probably only 10% of them had been vaccinated. Right. And so, so the vaccines work. And then if you also look at what are the number of people that have been vaccinated versus the number of people that have been vaccinated who then had a breakthrough, we're talking about just shy of 7,000 people. And we're almost at 250,000 people with at least one shot in the arm. So I think it speaks for themselves. Is it perfect? Absolutely not. But does it, I think what we're really argue over isn't what the numbers are. I think the real question is, what does it mean, right? So when we say, does it work? Well, yeah, it does work. Does it work perfectly? No, of course not.
But vaccines are never designed to ultimately stop everything. There's exceptions, obviously. Polio is one. Yeah. Measles, for the most part.
Yeah, smallpox.
Right. And smallpox.
Yeah.
But of everything else that's out there, flu, and pneumonia, all those, the effectiveness rate is just not anywhere close to what the vaccines are. I mean, the data is just shown. I'm going by data. If it was I can tell you right now, folks, if it was an utmost failure, you'd be hearing me way more talking about that. I think you'd hear Dr. Keiser saying, hey, this isn't working. We got to go another direction. Yeah. That's the point we're just trying to point out. The data is the data. These numbers, folks want to try to make it that it's all a lie or something like that.
Yeah.
But the data is the data.
And I think just to try and reassure people, we've tried to steer an independent path in terms of the data, looking at our own data. We vet it very carefully. So when we say we have, 5,000 cases, every single one of those cases have been looked at and verified. And we have our own data on who's been vaccinated. And again, that's been all validated and verified. And what we see here in our community with our doctors and your neighbors and your friends and your family members is that these vaccines are very effective in preventing COVID, just like they are in other places. So it's not just, people in New York City. It's not just, some talking head on TV that you don't know. I mean, these are people that who have gotten the vaccine and who have benefited from it.
Yeah, and as I said, this is just data that we're talking about here. And I think one of the things we also may be wringing our hands a little bit too much about what is actually a minority here. I get there's a lot of folks I know of that will separate what they say about. I just don't listen. They go, I'm all for vaccinations. I'm vaccinating myself, or I'm all for treatments. And I'll use it. They just don't like the mandates.
Well, that's right. Right.
We haven't had a real mandate in place around here in a while.
Yeah, and we certainly haven't had a mandate that people be vaccinated except in the exception of within the healthcare community, right? And that's something that came down from the federal government. And when you think about it, I mean, we have a very conservative Supreme Court, and even they've held that up because it makes sense. If you're going to be a frontline healthcare worker taking care of sick people that are at risk, it makes sense to say that you need to be vaccinated, and both for your own protection, because if not, you're going to get COVID, and also for the protection of people around you. So that it just makes sense. But in terms of mandating that other people do it, I've always been a little skeptical of that. And because you think it through, okay, you're not going to get vaccinated, so what's the alternative, right? We're going to hold you down and make you. We're going to chase you down. We're going to send the cops out after you. I mean, what's going to happen? And it doesn't make a lot of sense. And so really our best tool in public health is persuasion, and to just talk to people and help them talk it through, and also try and get to know people and let them get to know you so they know that you can trust you and you're not making stuff up, and you don't have an agenda. I don't have an agenda. I'm very apolitical, and I really don't care a lot about this other stuff. I just want people to do well.
Although a lot of decisions right now are being made kind of in the political spectrum, where you're seeing the withdrawing to that because they're realizing the public just is not going to respond anyway. Yeah, it's kind of like that. That's important there. Go along. No one's also denying now, as you said, that those who have been infected with COVID-19 actually does afford more protection than thought before.
That's right.
And that's 2 years of data that have shown that now, but it still wanes faster than you would without a vaccine. And you're more susceptible to reinfection. Whereas, as you said, it's showing that if you have had COVID-19 and you have also been fully vaccinated, that we're seeing those numbers really solid as far as folks staying healthy.
Right. Those are the people that have the best immunity. So the problem is you have to survive your COVID, right? So if you're 16, okay, fine. But if you're if you're older and you're at risk for having a bad outcome, you're really playing Russian roulette if you do that. But that being said, I have a friend of mine who had COVID, got his shot, and then got COVID again. And I'm like, you're just breaking all the rules, you're the guy that should have been the best protected. You're the last guy that should have gotten a reinfection, but you did. And that, I think, is part of the sense of confusion that people have, and which leads to the distrust, is that, with biology, it's not a rule. It's not a hard, fast rule. It's statistics, it's averages, and everybody's a little different, and everybody's response is a little different. So, that the naysayer can say, well, I know a guy. They're not lying. They're telling you the truth. They know somebody who doesn't fit what people like me told them should happen. And that makes people suspicious, but that's just the way it is.
Well, and it always is. And then too, but when we look at the actual data of that, those breakthrough cases after vaccination, even after having, are rare, less than a certain point.
Right. And almost none of them get hospitalized.
Right. Which is and again, goes to what the topic has been. I know a lot of numbers focus on deaths early on. And in taking into account immune compromised folks. I mean, we have talked that, that even in those cases where we're seeing where it says fully vaccinated and died, a lot of folks take that and say, see, it's not working. But if you actually look at the cases,
Right.
it says, and had other symptoms that chances are they would have died, but this just fast forwarded it.
Mhm.
And it is, and we use Colin Powell, I guess, as a lot of the example of
Oh, yeah.
somebody
Right. Yeah.
whose immunity was compromised from the start,
Mhm.
and then COVID-19, the vaccine, and then after
Right.
that, that's eventually just the body just can't keep up
Yeah.
with that. So
Yeah. But also now we have an antibody infusion for people like Colin Powell, right?
right.
So had he gotten COVID, well, not if he'd gotten COVID, if he were around today, we would give him these antibodies and he wouldn't get COVID. So again, it's all these incremental changes that are really getting us to the point where we can feel much more comfortable with this disease than we could 2 years ago and even a year ago.
And it goes to, I hear this a lot from people, is, well, we should have been focusing on therapies from the start.
Yeah.
It's not like it wasn't being focused on, but yeah, the vaccine is kind of like the first step, because
Mhm.
in the long run, that's what serves as the baseline to get to therapies. Is it not? Like, okay, we want to
Yeah,
create the vaccine first.
Well, you want to
And
do, usually what you see is you see dual arms of it. And, so it's not unusual to see vaccines come out, particularly with new diseases, because it takes a while to figure out, let's back up. We understand what makes vaccines work. Okay. And we understand that when you have a virus, you need to make an antibody that binds to a certain specific part of that virus and that neutralizes it and keeps it from propagating itself. But we don't necessarily know what to put in a pill to kill that virus, and that takes a little more work to figure that out. So that's issue number one. But quite often, what you see is people working in parallels. Somebody they put the virus in a test tube and they put different drugs in. That's how remdesivir got.
that's how it came about, right? They were just putting it in.
Yeah, they had no idea whether it was going to work or not. They just put a bunch of drugs in and said, "Oh, whoa, look at this one. This one kills it. Let's try it. Let's run with that." And then drugs like Paxlovid, well, that was designed to kill the virus. Now that came much later. And then you also see, antibody therapies. Well, initially, what we were using, we weren't using monoclonal antibodies. We were using human sera, right? And sometimes it worked and sometimes it didn't work. Well, why is that? Well, sometimes people had good immunity and sometimes people didn't have good immunity. And sometimes people had so much immunity, it worked extremely well. And sometimes people had a little bit, so it kind of worked, but not worked all that well. And so that's why they thought, okay, this is too inconsistent. We need to focus right on that, right, on the virus. And so going through all of these things can take time, and you never know what's going to work. I mean, in my former field, or I guess it's still my field, which treating HIV and AIDS, they've been looking for a vaccine since 1983. Okay, there's no vaccine yet, right? Got great therapies, got great pills. You can take one pill once a day, minimal side effects, live a very long, productive life, but no cure and no vaccine at this point. So sometimes it depends on, again, it's biology. And so, which means that everything's different and you can't necessarily take what you've learned from one and move it over into another and expect it to work. And fortunately, I think because we live in the United States, these therapeutics have been developed so rapidly and so well. It's really amazing. We should be proud of our country. We should be proud of our scientists that have done all this work.
I will say one thing. I mean, 2 years that a lot of the progress has moved forward.
Yeah.
And if you look through the history of the world, it's when a challenge like this comes up and you see amazing progress in some areas, and that progress then sticks and leads to the next big leap at some point. And we talked about it when we talked about HIV last week, that mRNA is now being looked at to create a vaccine for HIV.
And I'm hopeful.
That doesn't come. I don't think it comes about, and it may have, because mRNA is not new,
right?
But it finally got put in practice in a widespread use here for COVID. And when folks said, "Well, if it works there, we should be able to do it here. Let's try on HIV. We've been dealing with this since the 80s. Let's figure this out. Will it work?" And at least to go on that path. And you and I had that conversation last week. about that because of what you'd worked on in the past.
Mhm.
And as you said, you'd like to be able to be around when you see that works.
Yeah, it
It
would
be something that
It'd
you
be
said it'd
fun.
be like a weekend, for you. Mardi Gras, we mentioned, is coming up this weekend, and it's also next weekend.
Mhm.
But as we saw, the Lone Star Rally Health District is going to be out and about.
Yep.
Now, you're going to do testing. Are you going to do vaccinations too?
Yeah, sure.
On site?
And,
Okay.
for people want to, we're really trying to push people to get boosters. I mean, yeah, I think those people that don't want to get vaccinated, they've made it pretty clear they don't want to keep getting hit over the head. So we're not going to beat people up to get their first shot, but we will if you want. But we really are encouraging people to get their boosters. So a lot of folks are behind on their boosters. So we'll be on the seawall on the first parade on Saturday night, and then the next weekend we'll be at the downtown in the in the event area. And then actually we have some of our public health workers in the first responders parade. So that's put on for people like them, to honor them and the work that they've been doing over the past 2 years. So we're very happy that they'll be participating in that.
Yeah, that'll be fun, and that's next weekend.
Yeah.
That first responders.
Yeah, that's next weekend.
Yep. And we're going to be covering that actually. Our Mardi Gras coverage starts Friday night here on I-45 now in Galveston. Now we'll be busy throughout both weekends, but that'll be coming up there. But we'll make sure we get by the booth there. Someone had asked you the question, and you bring up a good point. If someone shows up at one of your tents and gets tested, it's the antigen test. They're going to know pretty quickly.
Yep.
What happens if you get a positive? What are you going to tell them?
Here you go. Put your mask on. You feeling okay? Need to go see your doctor. It's probably not a good idea for you to hang around here. Probably best thing is go home, take some Tylenol, get some rest. That's what we're going to tell them. The reality is that, even if we find people, for every person we find, there's probably going to be 10 people there that are not getting tested, right?
Right.
And we recognize that, but also it's an outdoor event, and we know that the risk of transmission at outdoor events is much less. So I think the thing to do is to encourage people to do the right thing, put a mask on, go home, take a break,
and then that'll be it. And then
yeah,
I just want to clarify that this came up during Lone Star Rally. I know when you say you can stop by and get a shot, they're talking about a vaccine booster. They're not talking about alcohol.
Yeah, that's right.
We were there, and I know people were probably joking, but twice we were at the booth, and my guys, these guys actually came by looking for like shots of a drink, and I said, yeah.
Well, we did have shot glasses that we were giving out. Yeah, so we didn't put anything in them.
They were empty.
But we had shot glasses so that they could do whatever they wanted to do with those shot glasses.
That's it.
So, and I don't know how many we have left or whether we'll be able to hand those out, but we were doing the shots for shots.
Yeah, a good publicity thing too along the way. And by the way, there's going to be information on HIV and sexual transmitted diseases and everything else as they do.
Right, and glucose tests for if you're worried about your sugar, and blood pressure checks, and somebody and some just trained healthcare workers there. So if you just have questions, want to talk, and they'll be there to give you some advice and point you in the right direction.
Gotcha. Dr. Philip Keiser, the CEO of the Galveston County Health District and Coastal Health and Wellness and the local health authority, and also an infectious disease expert with UTMB Health. Have I missed the title for you?
So far? You got plenty. That's enough.
Yeah, and everything else. So, great. It's glad to have you on again here. Thanks a lot. Appreciate it.
Good to be here.
We'll talk to you again next week when we come on. As I said, we're going to spend more time on our shows talking about getting you in for your screenings and the like for other ailments. But one thing right now, if you've not had one of your cancer screenings in a while and you're particularly in a risk status, get in now. If you've got a heart ailment, this is, by the way, this week is Go Red Week around our area, as well as we'll be out at talking about heart health this week. In fact, that's tomorrow at noon here on I-45 now in Galveston. Now the UTMB Healthcare Unmasked, where we're going to be talking about heart health and heart disease. That's going to be our topic for tomorrow. So make sure you're getting those screenings out there. And we're going to provide more information on that as we do this each week. So thanks for coming on, Phil. Good to see you again, partner. Have a happy Mardi Gras. Hopefully, will you be in one of the Mardi Gras parades?
Yeah, I'm going to be in I got invited to be at the crew of Gambrinus. So
you're going to be in the crew of Gambrinus. All right.
Yeah,
well, say hello to His Highness Eric Gage, the new king there. We were just there this weekend, so we see it now. Are you just riding along with them, or are you actually going to be playing your guitar when you do this?
No, I'm the Grand Marshal.
You're the Grand Marshal.
They asked me to be the Grand Marshal. Yeah. So, it's actually kind of funny because when they asked me about it, the numbers were really high, and I'm going, oh my God.
I'm not sure.
But it's like, well, they'll probably be okay, and it's turned out to be okay. And then we've gone to a couple of their events, and they've been just so gracious to us. And they really, again, they wanted to highlight the contributions that public health has made and that everyone has done. So initially I was like, I don't know, what should I do? And it's like pretty hard to turn them down under those circumstances.
Well, in this case, then on Saturday night, that's the Crew Gambrinus Parade. Starts on the seawall and then heads to downtown. Make sure you're there. The Grand Marshal of the parade is our own Dr. Philip Keiser. He throws you your beads. Just make sure you catch him. We don't want to have anyone injured if they hit you in the face. Have you worked on your? I know you've been in the parades before. You've worked on your bead tossing to make sure.
No, I've never. You know what? I have never tossed a single bead.
You haven't? Okay.
Because usually my hands are full. I'm playing my guitar when.
That's it. Normally, that's what I say. Normally, when I see you in a parade, you're actually playing a guitar with your band.
Right. And I don't. I can't throw the beads. So this will be fun. And believe it or not, that's hard work. By the time you get done a whole parade and you're there playing, and it's like, oh, I'm beat. So this will be fun to be able to
make sure you're underarm. Don't throw them like this.
Okay. All right.
Underarm. But you're still going to have tendonitis come the next day.
Okay. Trust me. Keep that in mind.
I'm a pro at this. So you're going to have to go in and get it treated. A little cortisone shot and you're good after that. So, all right. Well, I didn't realize you're the Grand Marshal for the Crew of Gambrinus Parade happening Saturday, Mardi Gras, Galveston. So congratulations on that. High honor. There's only been 33 of them. So there you go.
Yeah, no, I actually feel very honored to do it.
Yeah, you should be.
I was kind of shocked when they asked me.
Great. And again, join us next week, folks. If between now and the next show, if you have any questions for Dr. Keiser, feel free to send them our way. We make sure to include those. If not, you can wait until the show. Then again, we'll do it around 2:30 to 3 o'clock next Tuesday. Good to see you, Philip. Have yourself a good weekend. We'll see you out on the parade route. I'm TJ All. It's I-45 now.